CASPER stands for Community Assessment for Public Health Emergency Response. The purpose of a CASPER is to rapidly collect information about community needs through door-to-door surveys at randomly selected households. They provide valid, population-based public health information that can be used to direct limited resources after a disaster or to inform local emergency response plans.
Well, we want to know the needs of the households in our community, but we can't interview every household. So we need to take a sample that is representative of the whole community. A CASPER is not a convenient sample. It uses a two-stage cluster sampling methodology designed by the Centers for Disease Control and Prevention. The first stage involves the random selection of 30 census blocks we refer to as clusters. The second stage involves the systematic sampling of 7 households from each of these clusters. As long as we reach the minimum threshold of completed surveys, this methodology provides us with a sample that is representative of our entire sampling frame, in our case, the entire island of Kauai, without having to interview every household.
The CASPER survey really provides actionable information that we and our partners can use to be better prepared to respond to any kind of disaster in our community. When we first started doing the CASPER survey in 2017, the recommendation for 14 days supply of food and water and medication was brand new. And one thing we wanted to assess was how well our residents were doing with following that recommendation. And as we've assessed that every year since then, we found that that continues to be a real challenge for many of the families here on Kauai.
Overall, the community feedback has been really positive. It's rare that residents have an opportunity to speak to a government agency about how they're doing and what their current needs are.
You never know what's going to happen. The barges stop coming and, there's no food on the shelves. So when they come around, I felt like, everybody should be getting prepared. Where we live on an island, it needs to be prepared. So I think it's a good thing.
One principle of public health is that we should engage with our communities. We shouldn't assume that we know what people need or are concerned about, but we should talk to them about that. And the CASPER survey allows us to engage with our community and better understand what the needs and concerns of that community are.
This is my very first CASPER. Since COVID, we haven't really had the opportunity to go out to do field investigations, so I'm actually really excited that I get to do it for an entire week.
In 2020, during the pandemic, we were able to adapt the CASPER survey and use it even during a pandemic in a way that was safe for our community respondents as well as for our survey teams. And it was only because we had done CASPERs every year for several years before that we really knew where we could make changes that would allow it to still be a meaningful survey while also being safe for everybody who was involved. And when we did that, one of the things we learned was that many people in our community were really struggling with getting enough food because of the economic impact of the pandemic. So the Emergency Management Agency on Kauai was able to respond to that by focusing on food distribution in the community, which hadn't been identified as a priority before the CASPER survey.
This is our 7th CASPER survey on Kauai, with our first one conducted in 2017. The majority of these have been preparedness CASPERs, which allowed us to build this capability within our local health department when the stakes were low, and enabled us to implement a CASPER survey immediately after a disaster, such as our 2018 historic flood event. This year, we are assessing emergency and evacuation plans, concerns about climate change and infectious diseases, and general life on Kauai.
I want to say that professionally, I have benefited by being able to work with our community, identify the needs, identify what exactly our community struggles with as far as preparedness, and how we can actually come back, share it with our leadership team here, and find ways to better encumber resources in the unlikely event of an emergency.
The CASPER survey is also useful for allowing us to assess emerging issues like the 2018 flood, or this year, fire risks and fire preparedness, and community concerns about climate change. Of course, we can also use the CASPER survey to assess more routine public health concerns such as communicable diseases, immunizations, measles, COVID-19, or mental health concerns.
I feel like it also has helped me build connections because these people that I talk to and I spend time with them, like we really, like some don't want me to go, you know what I mean? And it's because in Hawaiian we say ho'o male male, like we take care of each other, we help each other out, and they feel a sense of that. So when I leave, they're always welcoming me back, and I feel like a part of me stays with them. So it helps me to develop and grow in working with others and connecting with them on a personal level outside of this whole professional hat that I wear when I go out there.
A lot of them actually didn't know that we were coming or that this survey was happening. But once we were talking to them about, I guess just asking the questions, one was preparing her own emergency kit, and she was like, okay, I'll get some ideas from the questions you're asking. So some of the questions, like, do you have a place to store your documents in something that's like waterproof or fireproof? She was like, oh, that's a good idea. So she got some ideas from some of our questions.
CASPER weaves meaningfulness into my work because it confirms to me that what I'm doing on a day-to-day means something, and it's doing something, and it's impacting the community in a positive way. I'm here to serve others, and I want to ensure that I'm serving them purposefully and meaningfully. So when I go out there and I see the struggles or the gaps in the community, it activates me to come back and want to work harder here so that eventually it can be poured into the community.
The results are presented in an infographic which just summarizes the main findings, and then a full detailed report that gives every question and all of the answers and our analysis of those answers. In short, what we learned from the survey allows the Department of Health, our partner agencies, and our community to better meet the needs of our community, and that's good for Kauai.